Hi, I'm Mia Crisafulli with Informa Connect Life Sciences. I'm here with Justin Foreman, Senior Enablement Executive at Apprentice IO. Justin, can cell and gene therapy focused organizations improve speed and maximize supply in today's market?
Yeah, absolutely. I think so. I think there's a number of ways for organizations to look to really capitalize on a number of different areas that have been improved over the last several years. Specifically for cell and gene therapy, I think there's really two key areas that they can focus on. One, adopting new and innovative technology that has come a long way in enabling them to manufacture with more speed and more predictability throughout their process, and further enabling their operators and their scientists to have a better work experience. I think a lot of folks have, rightly so, been focused on what they call the Great Resignation over the last couple of years, and that's certainly no stranger to the pharmaceutical industry. So making sure you have those systems and processes in place to enable those new employees of yours to come on board and quickly and rapidly onboard and help to drive that process forward is going to be critical for organizations.
Okay, so why is now the best time to shift toward the adoption of more modern technology?
It's a great question. So I think it comes down to really two key areas. One, the technology has come a long way, as I just previously referenced. Throughout the last 10 years or so, this concept of Pharma 4.0 has always been kind of tossed around, but really in the last several years, Pharma 4.0 is no longer optional at the end of the day. So the technology has really evolved to the point where it enables organizations such as cell and gene therapy that need more flexibility to really adopt earlier as opposed to waiting for later on in their life cycle stage. The second element of that is really the industry as a whole, I think, is really latching on to this idea of cell and gene therapy. New modalities have come across over the last several years, but even the FDA has really seen an uptick in the number of INDs that they've taken on in the last couple of years, and they're really trying to push for organizations to submit more and more.
Okay, and what are current concerns with traditional manufacturing strategies?
I think that really comes down to the systems that support manufacturing today. Legacy systems have been around for a very long time, and they were designed and implemented by large pharmaceutical companies that were really focused at the time, 20, 30 years ago, on small molecule. So a very repeatable, very standard process. That was great, and those legacy systems were designed to handle that in a very rigid way. Implement, don't change them, let the process run, and just find that kind of golden batch, if you will. Today, unfortunately, that rigidity is very limiting for organizations. So you need the ability to have that flexibility and that configurability to match the needs of what an organization might be looking at doing today, especially for an organization like a cell and gene therapy.
So why is Apprentice best suited to meet these changing demands of the life science industry?
My favorite question. So I think Apprentice is uniquely suited in a number of different ways. So one, Apprentice is built from the ground up as a cloud-based organization. So we are Pharma 4.0 through and through. And I think that provides a number of different areas for cell and gene therapies to really excel. One, first and foremost, it removes the IT burden from an organization that very likely is running rather thin in terms of resources. The second element there is that we can enable folks to have a configurable system. So instead of having to do heavy implementations and customization for an application, you're able to take our platform, grow with you from a very early life cycle stage where you need that configurability, that flexibility, let's say in preclinical or clinical stages, and then configure the system as you grow throughout your life cycle to clinical, and hopefully, obviously, once you maintain approval, or seek approval for the FDA. So there's a number of different functionalities, if you will, but really at its core, the platform enables that flexibility, that great employee experience with a very user-friendly application or user interface, as they say, and really just helps organizations to adopt technology at a much earlier stage and grow with you instead of having to maybe start with paper-based processes that a lot of folks do, and then you look at a new system in maybe 3 to 5 years, you outgrow that system, and then you look again for another system in 3 to 5 years. We really wanted to make sure that our platform could grow with you over time so that the investment you make earlier on becomes one of an appreciating asset rather than something that is dragging you down.
Okay. Well, thank you so much for your insights.
Absolutely. Thank you, Mia.
Yeah.